Apollo Cancer Centers launches CanWinA support group that brings everyone together in their cancer journey. Its first activity is Stories from the Stage by Cancer Winners in a significant step towards marking National Cancer Survivors Month. Apollo Cancer Centers, ACCs, today announced the launch of CanWin, a cancer support group that brings everyone together in their cancer journey rooted in belief that shared strength can change lives. CanWin, a brand agnostic platform brings together oncologists, psycho-oncologists, patients, survivors, caregivers, and volunteers to create a compassionate community built on empathy, support, and shared understanding. More than just a group, it's a safe space to talk, listen, learn, and heal. Whether you are recently diagnosed, undergoing treatment, or a caregiver, or living beyond it, you are not alone. CanWin, a name that embodies two powerful ideas. There's a can in cancer, a quiet reminder of strength and possibility. And there's win, not just a destination, but a mindset. A decision to rise with grit, grace, and determination. The initiative was launched with an emotional storytelling session led by the cancer winners, where each one of them took the center stage to share their personal stories of courage, strength, and triumph. These raw and inspiring narratives served as a beacon of hope for others walking down a similar path.
Our winners today. Well, I always refrain from saying survivors. They're not survivors. They are much beyond the survivors. They are our winners today. And I welcome all the winners here today. Apart from that, I also welcome my friends from the media. I welcome my colleagues, the consultants who've been treating them. I welcome my other colleagues from the Apollo International Oncology, and all of you here. At Apollo Hospitals, we believe that something has to start. And when something has to start, there has to be a spark. And the spark, which has actually started with this support group, and we've aptly called it as CanWin. It is possible that when we come together, we share a common platform, we share common thoughts. Also, sometimes we share some common ailments. And when we come together, it is possible that we can win over anything and everything. Without taking much of your time, I would request my other colleagues to give you more introduction or more details on this program that we've launched. And Apollo is always known for doing something different, leading the way, showing newer technologies. Currently, we cover the country with 73 hospitals spread across the length and breadth of the country. And our chairman, Dr. Pratap C. Reddy, always mentions that a patient should not be deprived of any treatment. If it is available in any part of the world, it should be available in India. And that's what started this organization 41 years back. He said if a patient can be treated in US, he or she should also be treated in India with the same standards or even better standards. Today we see any kind of treatment, any line of treatment is available in the Western world is also available in India. And Apollo takes the pride in bringing it to India the first. If it comes to India first, it comes to Apollo first. That's the way that we've been looking. Breaking newer barriers, building newer challenges, that's the way that Apollo has been. And today with this launch of the program called CanWin, we're breaking another barrier where winners can come together, talk about their stories, talk about their adventures, and inspire others, inspire the whole world, inspire the community, and take everybody together so that we can see a better India as we move forward. Thank you very much.
So I'm Dr. Jayanti Tumsi. I'm a breast cancer surgeon. And I've realized in my practice that treating a patient with breast cancer is not only about removing the tumor or prescribing therapies. The treatment has to be more holistic. We also need to treat not only the physical ailment, but also the mental agony that the patient goes through when they are diagnosed with cancer or even when they are going through the disease. And this, I think, is very important to have a support group wherein in this group there are people who have gone through the same experience, the same fears, and same amount of uncertainty. And they are, when they are together with each other, the synergy is amazing. I have seen in my practice that these support groups are so powerful. They're so powerful. It is better than the counseling that we do or any best of the best counselors do. Because the patients who have gone through the treatment, if they talk to the newer patients and tell that yes, it is possible to have normal life after cancer, and I'm the live example of it, it is extremely powerful. And I'm very happy that we have come up with this concept today. And also, as clinicians, how does it help us having a support group? I have realized that adherence to the treatment is better when people are in a group. Their anxiety levels, their fear, the stress comes down when it is shared by people who have already gone through it. And in fact, we have a robust cancer survivors group, and they are doing an amazing job because they find a purpose now after coming out of cancer that they want to give hope to a lot more people in the society. In fact, they are the brand ambassadors. They are the ones who inspire us and tell us that yes, normal life after cancer treatment is possible.
I'm Dr. Neema Bhatt. I'm a consultant hematologist. So I'm a person or doctor who treats blood disorders. I do bone marrow transplants and also treat children with cancers. So I'm dealing with a set of very specific, very sensitive, very naive patients who have not really been through much therapy. They've not really been through much in life, especially when I talk about children who are being diagnosed with cancer. If any of you know any family or a child who's been diagnosed with cancer, we know as the oncologist for that particular patient that I'm not diagnosing just that child. I'm sort of putting a diagnosis on the entire family. So because family, friends, the whole community is sort of involved, especially when it comes to caring for a child with cancer. And as Dr. Jayanti rightly said, we're not trying to treat just the disease. We're trying to treat the patient as a whole. And when I'm talking about a child with cancer, we're treating the family as a whole. It's not just one person, it's the whole entity, which is the family. So in the bare minimum of 15, 20 minutes, 30 minutes that we get, to break the diagnosis, to talk about the medical part is only not enough. So imagine talking about the entire psychosocial aspects that come with it, the repeated follow-ups that come with it. Both our adult and pediatric patients who are diagnosed with blood cancer usually require treatment for about 1.5, sometimes up to 2 years, with a lot of repeated visits to the hospital. Despite that, sometimes we're looking at 90% cure, sometimes we're looking at maybe 70% cure, depending on how severe the disease is. And despite all the treatment, they may still have to go ahead to undergo what we call bone marrow transplantation, which can be a quite challenging therapy for a lot of families and patients. So the 20 minutes or 30 minutes that's given to us, as I said, we are basically barely able to get through the medical part of it. So to address the social part, the emotional part, to normalize the aspect of taking chemotherapy, the harrowing treatment that comes following the diagnosis, that is where I think our support groups or our patient support groups are extremely vital. So they play a pivotal role, because without our support groups, I think our patient groups will be sort of left high and dry. Yes, they have the best access to the medical therapies, as Mr. Uday described. Whatever comes to India in the form of medical care, initially or in the beginning comes to Apollo.
Heart, but all those heart-related tests were very normal. So doctor said, because you are having bloating problem and also low hemoglobin problem also was there, so he suggested us to consult gastroenterology department in Sakra. Then we went there and they conducted endoscopy and colonoscopy. In endoscopy, they found a tumor in my stomach, which is malignant tumor, which is very close to 4th stage. Then we came home and went to met my doctor friend, Dr. B.M.K. Reddy, who passed away recently, but he was working as a radiologist in Apollo Hospital. He saw my reports and immediately he arranged a meeting with his colleagues in oncology department. Then we had a great discussion about my disease, but that discussion and meeting gave us a clear picture of what is my disease and what type of treatment I should go. That was really a blessing to me. And all through my treatment, I think I was quite cool and calm. Because all my mental well-being is mainly because of 3 things. One is my faith in God, and second one is faith in doctors and the team of doctors, and third one is my family and friends who prayed for me and who their prayers gave me a lot of confidence and strength and mental strength to fight my disease. Actually, during this treatment, my main support was, of course, family and Dr. Vishwanath and his team of doctors. And because whenever they used to come for rounds, they used to give me a lot of hope and encouragement by patting my shoulders. That gave me really a great reassurance in my condition.